Well, tonight, KETV Investigates uncovers new information into the Target gunman's past. I'm Rob McCartney.
I'm Julie Cornell. Family members say Joseph Jones suffered from schizophrenia. The Sarpy County Sheriff even confirms to us he's taken a gun away from him before. Now we're learning more about his prior contacts with law enforcement, well before he ever walked into the Target at 178th, armed with 13 loaded magazines and an assault-style rifle, and started shooting. KETV investigative reporter Joey Safchik joins us live with what she's learned.
Rob, Julie, today the Sarpy County Sheriff gave us some insight into the 4 encounters his department had with Joseph Jones and his family since 2017. We have the reports ourselves. They range from a missing person to a DUI to the one that really stands out when his family feared he was unfit to possess a firearm. The Sarpy County Sheriff still possesses a gun confiscated from Joseph Jones in 2021.
He has repeatedly tried to get that gun back, and we said no. Some people will tell you that's a violation of his Second Amendment right. It might be.
The sheriff says the Target gunman's family did not want the Glock back in Jones's hands. On Wednesday, Jones's uncle told KETV Newswatch 7 his nephew had schizophrenia.
He was mentally unstable, and the system should have taken away his rights when he became a danger to others.
The Sarpy Sheriff took Jones into emergency custody in November 2021. According to the incident report, a deputy, quote, saw issues that definitely needed to be addressed.
And so we always, whenever possible, err on the side of caution. We did not give the handgun back to him, but he certainly had a right to go out and buy one, and he did. So.
Not just a handgun, but an assault-style rifle, which the sheriff says Jones could purchase from Cabela's because he never went in front of the Sarpy County Mental Health Board, which a doctor has to recommend.
But really, our hands are tied. Once we've taken somebody in, they see a doctor, sometimes they're given medication, 2 or 3 days later, they let them out.
Sarpy County's chief deputy attorney says a very small number of people taken into emergency custody end up in front of that mental health board, which can place people in mandatory treatment and limit their ability to purchase a gun.
If the patient voluntarily agrees to the treatment plan, then there's no need to go through with the Board of Mental Health hearings. It's kind of like a plea agreement or a Board of Mental Health case.
But oversight about whether people are following through on their treatment isn't perfect. Larry Dirksen says his nephew preferred recreational drugs to those he was prescribed.
We know there are gaps in the system, and we're working every day to try and close those gaps. Whether closing those gaps would have made a difference in the outcome here, I don't know. We can't speculate, but we're going to try and make it better.
A family member can refer someone to the county attorney in hopes of getting that mental health evaluation, but a medical analysis still has to deem that person dangerous before a hearing will even be considered. Rob, Julie?
Joey, thank you.